Well, good morning, everyone. And once again, welcome to another live this morning. Hope you're having a great start to your day. And we sure want to say hello to a few friends here as we get going. And let me see, who's number one on the hit parade today? I think it's going to be Brahim. That's my guess. There he is. It's Brahim. Andrea, Niagara Falls, good morning to you. I don't know how you guys do it. I guess you'll never tell me. Kevin, how are you? Madeleine, how are you? Rosalinda, Niagara Falls. And John, how are you? And Nativity, good morning. And Rachel, how are you? Fran from Orangeville, good morning. And Sandy from Minnesota. Eric, salut. Beverly, New Brunswick, how are you? Rita, good morning to you. And Jeanette, nice to have you on. Marl, hi from Ottawa. Norma from Texas. Rita, good morning. And Wendy from Markham. And Donna from Park Hill. And Bonnie, good morning. Little Britain. Sharon from Kansas. Georgie from Nova Scotia. Linda from Chatham. And Arlene, good morning to you. And Milika. And Nellie, how are you? Rebecca from Callender. Joanne, Berks Falls. Donna, another Donna. We love our Donnas. Jeanette, how are you? And Luella, West Tennessee. I'm going to say hi to Doc McEwen because I'm just assuming she's on. Hi, Lisa Marie. Diane from LaSalle. Micheline from Sturgeon. Dorothy. Nancy, Gore's Landing. Couple of more guys. Dave, how are you? And Karen from Coldwater, and I imagine it's cold. Debbie. Rosa, good morning. And Sandra, how are you? And Maureen, Boca Raton, Florida, how are you? Janine, Mary, good morning to you. Thanks for coming on, guys. Gary, nice to have you. Judy, from the clouds, she says. Rosemary. Frida, how you doing? And Francis, good morning to you from Vaughan. And Arlene. Okay, guys, let's get going on the question. Joanne, Berks Falls, two more. Wanda, I was waiting on you from Virginia. Elsie, Elsie's birthday today. Well, happy birthday, Elsie. Nativity, Donna. You know what, guys? We always appreciate. Let us know if it's your birthday. And because we'd like to wish you a happy birthday. And Margaret and Lise and Wendy from London. And Helga, Scarborough, Sandra, McCarroll's Lake, Paul, Edmonton, Nicole, how are you? Okay, let's get to the questions. Jerry is asking about vitamin B12. He's asking, is there any truth that taking B12 helps to reduce mosquito bites? Well, I've heard it. Jerry's asking why. Well, B12 is good for everything. I mean, people are so low in B12. I don't know, Jerry. I mean, one thing B12 does, it protects every nerve that you own. The myelin sheath on your nerves. I don't know if B12, it's for that reason. I'm trying to think of others, but B12 is an essential vitamin. Okay, it's essential. People are very low on it. But I've heard the anecdotal evidence that B12 reduces mosquito bites. I don't know. I don't know if any studies have been done, but I've heard that too. I don't know, Jerry, not going to hurt you. If you're going down to Costa Rica, I see, and you want to, look, bring your oil of oregano. Don't travel without it. Bring your probiotics. Don't travel without those too, for sure. Okay, Jerry, thank you. Nancy wondered about my thoughts on wax candles that have essential oils in them. I like essential oils. I don't know. Some people are bothered by essential oils, fragrances, even natural ones like essential oils. I like them. Some people are bothered by any fragrance. Is there any benefit to putting that in the air? I don't know. You know? I like oil of oregano. Any other oil? No, eucalyptus, my dad used to use a lot of that, and on sinuses, and he loved eucalyptus. Okay, I don't know. What are my thoughts on it? Hey, go for it. If you like it, go for it. How much benefits you're getting from that? I'm not sure. Okay? I'm not sure. Leary is asking, what foods that are supposedly anti-iron? Well, I'm going to tell you what's pro-iron. Okay? The foods that are pro-iron are red meat, liver, steak. Why? Roast beef, hamburger. Why? Some pork. Because of heme iron, H-E-M-E, heme iron. That's the best iron. That's the iron that your body likes the best. Okay? It's the most bioavailable iron. Now, there are anti-nutrients. You know, I have a whole chapter in my book, Sun, Steak, and Steel, about anti-nutrients that sort of chelate even iron, okay? And those are in the plant kingdom. Now, does that mean you can't have any plants? No, of course not. I'm not for that, okay? Like if people like strictly a carnivore diet type carnivore, which has got lots of ink these days and very popular are carnivore diets. Obviously I do like temporarily carnivore diets. Now, if you can, and it's actually good for you, if you stay on a carnivore diet, especially people with autoimmune and whatever, but I'm more on a level of thinking that I like some fruits and some vegetables. My rule of thumb is that you don't live on that stuff, okay? That doesn't mean you can't have it, and I know a lot of people just love their vegetables and love their fruit. Hey, I'm all right with that. But you have to understand that you don't get the iron. Some of those vegetables are actually anti-iron to some extent. But I don't care if you have some vegetables. I really don't. I don't care if you have fruits. I don't want you to live on them. The sweeter fruits like bananas and that, use sparingly, because my overarching principle when it comes to food is insulin and insulin resistance. That's the key. Okay, that's the key. And you want to have the most nutritious, orientated diet that you can have with the most macros, the most protein, the most bioavailable protein and amino acids, the most minerals, the most essential vitamins. That's in the animal kingdom, guys. So, I teach that. I've always taught it. I will continue to teach it because the world has it upside down. They have plants, fruits and vegetables, and grains at the top of the list. Should be the top of the list. I'm not saying you, and I'm not big on grains too much either. But again, when you ask me questions like that, I'm not a carnivore. Okay? Strictly carnivore. I like carnivore. I talked carnivore before they even called it carnivore. Okay? I'm big on the animal kingdom, guys, and you guys know that. I emphasize it. It ought to be the most important part of your diet. Eggs, meat, and cheese. Dairy. Don't ditch dairy. Switch dairy. You can have yogurt, plain yogurt. Somebody asked the other day, why is there sugar in plain yogurt? Well, it's because of the lactose. Milk naturally has some sugar in it. It's not a high amount, but the problem is today when you go to the grocery store and you get milk, it's denatured. Why is that? Well, first of all, it's pasteurized at a very high temperature. And then second of all, they take the fat out of it. And when I was a little kid, milk had a lot of fat in it. You had to shake the bottles. And it was only in the late 60s and the 70s, they started coming out with this skim milk and fat-free milk and all that. That was the worst thing you could do to milk. And now it became white Pepsi. Very sugary and devoid of fat. You see, fat don't make you fat and fat don't give you cholesterol. Okay? Well, it gives you cholesterol, but it's good for you. Anyway, okay. You guys know that I repeat. And Leary, the question was, are there vegetables that are anti-iron? Yeah. I wouldn't worry about it too much, but don't live on them and you'll be fine. And eat a lot of meat and you'll get a lot of iron. Okay, Shelley. What diet is best for a nursing mother? Eggs, meat, and cheese. Eggs, meat, and cheese. That's the best diet for a nursing mother. You got all the nutrients. You got all the protein. You got all your vitamins. Eggs, meat, and cheese. Nursing mom. Baby gets that. Okay? Baby gets that. That's the best diet. And you can add some fruit. You can add some vegetables. I got no problem with that. Nursing mom. Baby will like. But the key is that protein. The key is that healthy fat. Okay? You want those fat-soluble vitamins, mom. They're in the fat foods. Eggs, meat, and cheese. That's where you get your fat-soluble vitamins. Vitamin A, baby needs that. Vitamin D, baby needs that. Vitamin K2, baby needs that. Okay. And best for baby and mom. Yep, both. Okay, Linda, what does Dr. Martin think of Ozempic? Well, I call it a designer drug. Linda. Very popular now. You can hardly get it. It's so popular. It was a medication designed for diabetes. You get weight loss with Ozempic. It can be pretty dramatic. But, B-U-T, but, lots of problems with Ozempic. Lots of problems with those designer weight loss drugs. Hollywood made them famous, and now you can hardly get at it because so many millions of people, because people, what they want is magic. Okay? Weight loss, they want magic. And it works. The problem is, and this is facts, you lose weight, but you lose muscle and not fat. Metabolically, that's not good for you. Okay? And I can understand the frustration. Listen, I've been in the nutrition business for 50 years. I understand when people have trouble losing weight. and they're big, and they want something that works. The problem is it can destroy your stomach. The problem is down the road, I'm telling you, you're going to see a multitude of cancers come and all sorts of problems with that medication, because it's exactly that. It's a medication. It affects the peristalsis. It affects your microbiome. It's got legion amount of side effects, and it's not even aiming at, like, if it was losing fat rather than muscle is metabolically is one of the greatest things that you could use in your body. Muscle is, you know me, I've been talking about muscle and the endocrinology of it. It's like you have another organ. You have another hormone organ that's on your side. If you have muscle, it makes a huge difference. We live in a different world. We live in a world full of sugar. We live in a world that's insulin, and insulin resistance, and all the chronic diseases that come from that. And you have something in your body that we didn't even know about 50 years ago, how good it was for you. You have muscle. And the more muscle you have, the better it is for you. Sun, steak, and steel. What is steel? Muscle. Build muscle. Endocrine-wise, it's one of your best friends. It stores glucose into glycogen. It's a storing place. It'll help you to resist insulin resistance. It'll help your pancreas. It'll help your liver. It takes away from your liver. It takes fat away from your liver. Why? Because your body will store it. As long as you have muscles, it'll store it in your muscles when you are making glycogen. So guys, I can't, and then you have a weight loss drug that, yeah, you lose weight, but you lose muscle. You don't want that. You don't want that. So I know it's popular, but you can't convince me that it's good for you. I'm not convinced. And like I said, I feel sorry for people. I do. I'm on your side, but I have to warn. It's not the panacea that they claim it is. And they're already proving me right. And when we go down the road of this, they're going to prove me even more right. I wish I was wrong, but I know I'm right about it. That's what I think of Ozempic and Wegovy and others. Okay, Marilyn, what do you suggest for perioral dermatitis? Well, look, what does it come from? If you have perioral is around your mouth, okay? Perioral, okay, around the mouth. And you get, dermatitis, which is inflammation of the skin and, usually red, patchy red, bumps and stuff around the mouth. When I see that, usually, well, one, you got leaky gut, 100%. You better fix that. I've often seen perioral dermatitis with people low B12, low vitamin D, okay? Those things, and leaky gut. Fix. Patch it up, okay? New study on, I saw the other day, maybe I'll bring it out this week, on quercetin and leaky gut. Helps to repair. Helps to repair. I you know me, I like quercetin, but there's another reason it helps to repair leaky gut. But you can't do it without probiotics either, okay? Patch it up. Okay, that was Marilyn. Dorothy is asking, what is the name of a bacteria you get in the hospital. C. difficile. It's actually, Dorothy, easy to remember. Think of difficult, okay? Difficult to kill. C, okay? ABC, C, difficile, okay? That is the bacteria that you find in hospitals. I've always said this, okay? Where is the most dangerous place to go? Your local hospital. Not Afghanistan, not the Middle East, your hospital. Now listen, okay? Don't get this wrong, okay? Because now I'm going to put a little disclaimer. Of course, when you're sick and you're hospitalized, thank God for hospitals. True or false? Of course that's true. So don't think Dr. Martin is crazy when he says the most dangerous place in the world is your local hospital. But it is. You go in, your immune system is already compromised generally. You go in for surgery or you go in for whatever, and C. difficile is found in there. And there's a couple of reasons for it. One, here's me. Here's me. Okay? You're in there, your immune system's already compromised, okay? That number one. Number two is the overuse of antibiotics. Because we overuse antibiotics, and where do they use a lot of antibiotics? In the hospital. You can't blame them, right? They're worried about infection. The problem is you get a double-edged sword. You get, it kills bacteria, but now the bacteria, they resist it. And they build a coating. And they resist the antibiotic. That's what C. difficile is. It's a antibiotic-resistant bacteria. It kills thousands upon thousands upon thousands of people every year. Found almost exclusively in the hospitals. That's why I say that. Okay? And if I had anything to do with hospital administration, I would be giving every patient that came in probiotics, vitamin D, and I mean massive doses. You're in the hospital, you need, and they could test it in 2 minutes. But they don't do it, but they should. I would be giving you vitamin D. I would be giving you vitamin A. Okay? D and A. Okay? Not your DNA, but vitamin D and A for your immune system if you're in the hospital to fight C. difficile and to get you better. Probiotics, vitamin D, vitamin A, and I'd have oil of oregano around everywhere in a hospital. You want to clean? Clean with oil of oregano. That's the other thing they do. They over clean in the hospital. I know, guys, okay? We talked about this before. You've got your body, and then you have outside bacteria. So I'm big on getting your body resistant to infection, building your body's immune system. You know that. I talk about that all the time. On the other hand, one of the things, we have to live with bacteria. And I don't like cleaners, and that's what they do. All the chemicals and all the xenoestrogen cleaners that they use, especially in the hospital. And no wonder there's superbugs. Okay? So, thank you for the question. That was, who was that now? That was Dorothy. And I was mentioning the C. difficile in regards to PPIs. Well, there's C. difficile, and then There's the other one that I mentioned with PPIs is H. pylori. Okay, so C. difficile is pretty well in the hospitals. Okay, that's where you get that. H. pylori, everybody, in my opinion, has H. pylori. But most of the time it's dormant. Okay, it's almost like a herpes virus. You get the chicken pox, you got a herpes virus. But it's supposed to be dormant. It's just in your body. Your body codes it and goes, okay, go to sleep now. Don't come back. Stay there. Stay asleep until your immune system's not working. Then you get the herpes virus. But the same thing with H. pylori. Okay? You have it. Everybody, in my opinion, everybody has it. But it should stay dormant. If you have good stomach acidity, that's the key. You see, even your stomach acidity is a huge part of your immune system. If you have a very, very acidic stomach, really acidic, well, no bacteria can get past that. H. pylori can't do anything. Even C. difficile has trouble bypassing the stomach that is very acidic. The problem is, most people today, because of their diet, they don't eat the right foods. They're sugarholics, they're carboholics. They bought the lie about fruits and vegetables being the best thing since sliced bread. Not really, but okay. No, but you know what I mean by that. And their pH goes up in their stomach, and that's not good. One of your major lines of defense in your body's immune system is your stomach. God gave you a stomach that's got more acidity in it than a lion has. Okay? As far as I know, lions only eat meat. But we have even more acidity than a lion because we're supposed to eat meat. And because we got away from it. And people have meat, Dr. Martin, that's acidic. No, it ain't. It'll make your stomach more acidic. You have more of an acidic stomach, guess what? You're going to fight infection a lot better. All sorts of infections that come in through, your upper, your mouth and your nose, your eyes, and you got a defense in your stomach that stuff doesn't get past. And even food poisoning, think of it. Salmonella and others. If you have a good acidity in your stomach, you got a good chance you'll never get sick from that kind of stuff. Anywho, did I answer your question, Dorothy? Okay, I think I'm just about done here. Okay, I was told about Linda. We love Linda's. I was told that with my blood work, I have too many red blood cells, and my blood is thick as molasses, and to stop eating red meat and eat more veggies. You know what, Linda? I just got a migraine from your question. I'm not blaming you. I'm glad you sent in the question, but I just got a migraine. When I hear your red blood cells, well, you got too many red blood cells, eat less red meat. Well, let me say one thing. Am I ever glad? Am I ever happy? They acknowledge that red meat has something to do with your red blood cells. Sure it does. But it ain't because you're eating too much red meat that you're getting too thick of blood. Number one cause of thick blood is a lack of H2O. That's the number one cause. Never, ever, ever seen a case. And I used to measure this. I've never seen a case. I know what's your problem. You eat too much meat and your blood is too thick. That is silly. And that comes from people that don't know a thing about nutrition. That's silliness. So, you want healthy blood? Eggs, meat, and cheese. the most nutrient-dense food, okay? It's the way it is. If you're not dehydrated, okay? Linda, if you're not dehydrated and you're drinking enough water, you're getting some electrolytes in your water, make sure, because that, like I said, that's the number one cause. It's the way you're built and your, your bone marrow, your spleen making red blood cells, and they're thick. It's the way you're built. It'll be good if you ever get a cut, because you'll clot up real quick. But you don't want thick blood like that, so make sure you thin it out, okay? And make sure you have enough nitric oxide. Keep your blood vessels open. Lots of water, nitric oxide. I love Navitol. That's the first thing I would have you on. Okay, Louise, why is it when a person walks, the knee bends quick every time it happens just in one leg and the foot hits the floor and they keep walking? I don't know, Louise. I don't know. Is it clicking? What happened? I don't know. I need more detail than that, Louise. I don't know how to even answer that question. Okay, I think I have everything else that has been done. Yeah, I think so. Guys, thanks for the questions. We appreciate it. We love you guys more than you know. Okay? And what's Friday? Question and answer Friday. So I got a lot of studies we're going to talk about this week, but if you want your questions asked on the Friday and often Monday podcast, then send it into info@martinclinic.com. Give us your feedback. We love it. Thank you for being such good friends to the Martin Clinic. And if you're not part of the private Facebook group, then please join there, okay? Please join there. We love to have you. Okay, talk to you soon.